on this computer. Okay.
Okay.
Good afternoon again to everyone. We are hosting Dr. Park today for second series of CAPER Scholars and Trainees webinar. We really thank him again for spending the next hour or so this holiday weekend with us and with trainees.
Thanks, Jamal. Thanks, guys, for taking your own time on a Sunday, on a holiday weekend. I appreciate that. And again, I apologize for coming late. There was a other patient call that had to happen, unfortunately, only on Sunday. So this all came about literally within the last 48 hours. And it was supposed to end an hour ago, but it kept going. So anyways, this is, this webinar series is in context to the CAPER Pancreas Scholars Program, that in addition to the in-person meeting that we had held, we also wanted to make sure there was some continuity of education. And there are 3 webinars, and I believe some of you participated in Daraj's first one earlier in June. And this is the second, and I believe Myson will do a third. Again, the primary intent is really to discuss a topic that would be of interest and relevant to you in an informal discussion free kind of zone. Consequently, I didn't purposely make this talk very formalized. I want it to be more narrative and personal and more reflective, and give you just a little bit about my own experience with grant preparation and writing, and then perhaps we can open this up. I also don't intend this to be an hour long, perhaps maybe 30 to 40 minutes, or however long you guys wish, to the extent you guys have questions. But my actual formal comments are probably only going to be about maybe 10 to 15 minutes, and then we'll go from there. So many of you know and have heard in the course of your training about the importance of obtaining grants as a part of academic success and academic promotion. And as many things in life, money makes the world go round, and that's the primary basis for a lot of the need to succeed in grant writing. Now, obviously, there are other reasons and benefits about doing so, but it exists primarily because for most academic positions, the opportunities to pursue research and your salary is primarily often hinged beyond your clinical revenue that you generate from seeing patients and doing procedures, is on the money you bring that will protect your time, that will allow you to focus on specific research questions and develop new knowledge leading to publications. So grants are these basically documents, these written documents that you need to put together that allow you to succeed in getting funding. At its simplest, it's about asking for money. And the question really is, why should they give you money? And in some ways, I like to think of grant preparation and writing as, and perhaps because I live in the Bay Area and there's a big Silicon Valley startup mentality, but in many ways I think about grant writing as you starting, you as your own startup, and the company is you. And you're trying to convince investors who have money to basically invest it in you and invest it in your ideas. And so there's a certain component of salesmanship then that comes into this. Obviously, if you don't have the science to back it up, you're not going to get very far. And like a cheap, poor salesman, people will see right through you, and you're not going to convince many people. So you definitely have to have the fundamentals in place in order to be persuasive in your grant writing. In my own background, before we kind of jump into it, I applied for career development awards near the end of my fellowship starting the third year of my fellowship as I was starting to transition into junior faculty. But I didn't really, to be honest, I started thinking about writing grants in my third year of fellowship, but I didn't formally put in my application for an ACG Career Development Award, an AGA Career Development Award, an ASGE Career Development Award, and of course the K awards until about the second year of my what we call instructorship. In some academic settings, when you complete fellowship, you'll join faculty right away as a junior, as an assistant professor. However, in certain institutions, because they feel that you have not amounted enough research data and time, you function as what's called an instructor, which is not technically a faculty position. It's somewhat of a kind of purgatory between fellowship and faculty. And so that was what I was, that was the position I held at Stanford for 3 years before getting a formal appointment. And the purpose of that time is to really dedicate yourself to getting to basically writing grants and getting the necessary preliminary data. So I didn't submit my first grant until the second year of my instructorship, because I spent the first year and the latter part of the second year and the third year of my fellowship generating the data and the setup so that I could basically put together a convincing story about a research idea that I had, and to show that my research idea had some feasibility and that I could succeed. These are all elements to what you need to consider as you think about writing a grant. In the course of doing so, you will, like submitting a paper and getting rejected, you have to anticipate and expect rejection, and to think of rejection not as simply that word, but as an opportunity to refine and revise your story. And I didn't get immediately accepted. I actually had multiple rejections. My first K award went in and I got scored a 40, which on the flip side was better than being triaged. Triage means it's in the lower 50%, then it wasn't further discussed. But on the other hand, as competitive as it was, I knew right away that it wasn't going to be accepted. So I had to revise that if I wanted to reapply and get a K award. But this is where applying to multiple foundations and organizations can help you, because you get different comments and different feedback and also different responses, and all you really need is one initially. And I was fortunate enough to get an ACG award, a Junior Faculty Development Award, which at least kind of got me going. And I would say that the part of grant preparation and writing is, it's not just, ultimately it's the product that you put together and that you submit. But I would also say to you that there is an opportunity to enjoy the process, because the process itself of writing it, and this is not something you should do over the weekend, but something that you think and put in iterative time in over perhaps several months, is that it allows you to really hone in many of your ideas. And what starts out as one idea, but over the course of evolution and reiteration and revision becomes something very different, perhaps more polished and better. So I think there is a very strong intangible benefit of the grant writing process, that even though it's often driven by pure economics, because you need to get the money to have the protected time, the process forces you to clarify and hone your thinking that perhaps you didn't have to do otherwise. And so that's the other benefit that's intangible from this process, and that you become a better and sharper and more critical thinker just by going through the active process of writing and rewriting and rewriting and rewriting and rethinking. So I think those are just some of the general bits that apply to my own personal experiences. And I'm just I only have about 4 or 5 slides that I think kind of bring back some of these points that I may have already touched upon. But so if we go into this, so I think it's important to, learn how to write well. I know that sounds very simple, but even when you guys started back, perhaps you had an English teacher in high school or college who, drew all over your essays and told you to like rewrite and not use the passive and make sure you write in the active. I think, being very succinct, but also being very clear and simple, I think is an understated art. I've also had the opportunity to review many grants, and the writing, unfortunately, I think they have a good idea, but if they're not able to communicate it in a very effective and persuasive way and in a very simple way, it already kind of shoots itself down. It's kind of shooting yourself in the foot. And so what I mean is be very careful about your grammar and how you structure your sentences. Now, if you think and along the way you've never been or writing hasn't been your strong suit, I would encourage you to, if you have the time and you're in the right institution, take some workshops on grant writing workshops. And many of your institutions will have those workshops available. On the other hand, you can also use someone who writes really well and ask them to critique your writing, just like you did in high school and college. But it's the most aspect of just part of this is not just refining your ideas, but also refining how you communicate those ideas. And part of it is you really want to tell a story. We read books, we enjoy movies. Part of it is because of the stories embedded in them. It's what captivates us. It's a story of, it's why we like biographies. There's an arc, there's a protagonist, there's a, and I would say, don't, in my own experience, I think the more you can tell the science like a story, like an aha moment or a suspense moment. And I'm not saying write a romance or a mystery or something. Don't take that out of context. But I'm saying, as you understand that this is a human process, and your grants, just like papers, will be read by other humans with their own biases and their own limitations on time. And so writing well and telling a story about, what you're trying to do will help captivate your reviewer and get them to buy in. That's what you really need them to do, is to buy in and advocate for your success. So in part of telling a story, I think where this kind of departs is you do want to sell this vision. You want to take your grant idea, and most of you will be writing grants that are appropriate for junior faculty. And what I mean by appropriateness is, on one hand, you want to be very clear about and very defined about what your project will do and won't do. Remember, people don't expect you to solve or cure cancer, but if your vision is that you want to have this, that you want to move towards understanding and curing cancer, don't be shy to put your story in that context. So you want to kind of sell the big picture, where your story fits in the grand arc of your career. Many of you, again, will be doing, this will be junior faculty awards. So what you're really trying to sell is what skill sets, what project ideas, what first step projects that are going to be important, but are clearly first step projects towards the vision that you want to do. So you want to sell your vision, but you also want to be realistic about what you're going to do. So I think this gets back to just making sure the reviewer understands the whole story. I think I kind of touched on making it persuasive. Again, you're trying to sell the idea, and you want to convince the reviewer you can do it. So the reason why I waited for 2 years, actually 3, before I applied for my first career development award was because I needed to convince the reviewer I could do what I wanted to do. And this was on pancreatic cyst biomarkers. And I couldn't just say that I wanted to evaluate and validate or discover new biomarkers without not having done any legwork. So I had to build a cyst infrastructure that where I was at that point had collected about 100. It took me about 2 to 3 years to collect and phenotype about 100 to 150 samples. And I had to then use some of those samples to show that we could actually show some of the biomarkers we thought could potentially be of use, and then go on to validate that. So I didn't even consider applying for my career development award until I could show that I had the capability to successfully recruit 100 to 120 samples, and I had already done so, and that I had already collaborated and with some of the labs here to identify some novel biomarkers, and that we've gone on to validate it. So, without having done that legwork, there was no way I was going to convince the reviewer. So this is the importance of having that pilot or that preliminary data. Now, there are some grants that are basically pilot in nature, and you can kind of sell an idea. But most grants will want to see some track record of success, some track record of feasibility. So again, I still love this idea of you going to an investor and it's like, why should they give money to you? Well, you might have a great idea and you might have a great way to kind of go about doing a project, but you need to show them that you've already done some of the legwork, that you already have laid down the foundation by which this study or this project that you're going to propose can succeed. Some of that's going to be in your publication record. I think that's why your own mentors and faculty have said you need to get abstracts, you need to publish papers, because that's part of the feasibility component, saying, look, Dr. So-and-so is a young and inspiring or ambitious investigator, and look, this is a track record of his or her success. He's already shown, or she has already shown that she can put in the legwork and do the work. She's published papers, she's completed projects. So that's part of it. But I would say a bibliography is not alone, is not good enough. You're going to need to get some preliminary data that shows that you're already starting to work on the idea that you're trying to get money for in protected time. Excite the reviewer. So this gets back to, it's kind of circular. You're going to go kind of, you want to write simple and clearly and tell a story, but you still want to connect the big picture to the minutia of your projects and your aims, and how those first steps are really connected to the bigger potential. So, at the risk of being a little redundant, you want to make sure you remind the reviewers as to why aim one, which might be a small project, is still connected and very important to your success in doing aims 2 or 3, or even related to your overall vision. So that's just something to keep in mind, that these. Another point I'll make later is about the nature of reviewing. But the other thing that I think is very interesting is, to the extent that this plays a role, is research is not just done by the individual. Keep in mind that when you apply for grants, oftentimes you're surrounding yourself with people who are going to allow you to succeed. Now, for most of you, that's going to be your mentor. But you don't necessarily need to have one mentor. You can, if you surround yourself and you're thoughtful and say, look, I'm working with so-and-so, and he or she is a clinical specialist in the topic that I'm doing research in. You may also want to get a mentor that also has some track record in the methods that you want to do. You may want to get some other people who are going to introduce you or teach you or collaborate with you on novel skill sets that you don't have. The point here is, if you have an exciting idea, you don't have to necessarily be expected to do everything. If you can learn or collaborate, that also is a very important concept that I think for most reviewers is assessed very positively in terms of funding, because it says that you're not overstepping what you think you can do, but you realize that you need to build a team, or you need to work within a team to make things happen. So I would strongly consider, when you look at your grant and your approach, to think about, are there other people that you should be bringing into this to help you, that you need to introduce and discuss in your grant, in your documents, that would make your project more compelling. Read the instructions. So one of the few things that I learned is the grant writing the grant is basically, in the totality of the work of a grant, 30% of the grant is your actual writing that I've been talking about. I would say there's about 50 to 70% of that is a bunch of other administrative documents that you need to work with your administrative official who will submit the grant on your behalf. And you will have to cultivate a good working relationship with this person who typically is experienced but somewhat bureaucratic in nature, because there are the instructions and there are certain guidelines, and you have to make sure that all the checkboxes are filled. A lot more time than you really think. The other reason I put that point there was, if they make sure that, just like writing a paper, that your word count, your word limit, your structure is exactly the way they want the grant to be structured. Don't give the reviewers an opportunity to ding you on some of these cosmetic aspects, because when it's competitive, they will. So that comment on reading the instructions is really a twofold comment, both in terms of working with your administrator, but also making sure you keep to the limit of that. I would also say along the ways, not just something I didn't put in here, but I should have, is it's not just writing well, but illustrate well. Most successful grants, in addition to telling and writing their story, has some figures and tables. And please, even though you might not think your grant might have it, the more you can put together figures that kind of show what your story is about, and preferably with color. I mean, we're getting really to something you might kind of dismiss as, wow, these are trivial aspects, but remember, again, these reviewers, as scientific and distinguished as they may be, are still human beings, and what appeals to the eye is what appeals to the eye. And you want to make your font clear, you want to make your margins clear, you want to have nice color, preferably, if you can, have some nice tables and figures and have them appropriately placed. These are some, so long as they affect, don't just put something in and it doesn't add anything, but if it reiterates certain key points, even if it's a diagram of the people you're working with to show that there's collaboration, or you can kind of show a figure of how it all works towards a vision. I think those are important kind of things that, again, simplify the story, because some reviewers will look at the specific aims, look at the abstract, look at the tables and figures, and they're kind of like reading it like a paper, because they don't have as much time, and they're trying to get to the gist of what you're trying to say. And so think about some tables and figures and try to make them colorful. I think that really enhances your story as well. So I'm getting to some of the nuts and bolts and some of the practical aspects of what I think now granted, my experience is limited. There's definitely more senior people who've written way more grants than I have. I can only give you my perspective on my success and my failures of the past 10 years. And this gets back, my final point on this slide of putting it all together takes way longer than you think, is to really start early, give yourself about 6 months of time. And even though you will be doing an intense amount of work the last 2 weeks of the grant, the more you can kind of get this process going. It just takes longer than you think. Just like anything you guys have probably done in terms of your own projects, things take longer than you think, and that is the same for grants. So most grants are structured with having 1 to 3 reviewers, often 3, because the odd number is nice to have to give some kind of non-equality, so you can have some majority vote if it matters. And the scoring system is often between 1 to 5 or 1 to 10, where the lower number is better. The NIH scale is 1 to 9. But a lot of the societies and foundation grants that you might apply for basically copy their structure from the NIH scales and the NIH structure. So they, as I said, the lower the score, the better. And the major structures or subtitles of your grants are going to be based on significance. So again, this gets back to the vision. Why is this important? Why should the reviewer care? And this is where you really want to think a little big and put your project in the context of a big, important public health need. Colon cancer. Yeah. And so part of what you need to do is you need to sell them and convince them that the big public health problem, the big public medical problem, whether it's a new diagnostic for curing pancreas cancer, or a new treatment for pancreatitis, or the failure of communication skills between providers and patients, the lack of clinical trials and so in endoscopic therapy for pancreatitis. These things need to be put forth up front. This is kind of the basis for why you decided to write a grant, because a grant is funding a project to solve a problem. What's the problem? You got to be very upfront and very clear about, and if you can't convince them that this is a problem, unfortunately your project is dead on arrival. So that's why the significance matters, and you really want to make sure that you've got the literature down on this, and that the literature supports your assertion that you are dealing with a significant problem. So that's a key point. If you don't have relevance, public health relevance, it can be dead on arrival. Investigators, this gets back to making sure who is the team, and for you, it's not just going to be you, but the K award is a good part of the K award is really about you, and this gets back to, frankly, where you trained, what kind of education you had, what kind of papers you've published already, and what kind of mentorship environment and what environment you'll be doing your research project in. And does that environment and institution have a track record for helping young investigators succeed in their career development? So these are some very practical, sometimes unfair aspects, because this biases institutions where success begets success. So one of the challenges, if you're at an institution that may not have as robust and comprehensive of a record of training young investigators, then you might need to align yourself. First of all, identify those investigators within your institution that have that track record and try to see if they would take you on as a mentee. The other way to compensate for that is to look at other institutions who can provide remote mentoring to complement your team as a form of insurance. That's the second strategy. I would encourage you to, as your primary strategy, is to look within your own institution and find the people who have been successful in getting grants and in mentoring, and try to align yourself with that. Because a big part of the Career Development Award is who you are and who's going to be ensuring your success. Innovation. So, what is the novelty that you're going to bring to this? If you've defined that there is an important problem, then that we need to solve it. You've convinced the reviewer that you've got a team that's credible, that's accomplished, and that can do this. Now, what is your contribution to the problem? How are you thinking about this problem that other people haven't really in any robust way? And what are you going, and so this is an opportunity for you to be clear about where you stand and where your creativity and innovation lies in this problem. And then the approach is going to be really getting into the nitty-gritty, and this gets down to kind of what you've done already to address the problem, where you want to go, and this is with your specific aims, and how are you going to get there. And a lot about the approach is the science behind the methods, but also that there's feasibility. And this is where you're going to be talking about not just what you're going to do, but can you really do what you want to do? And have you thoroughly thought through sample size calculations? In other words, will you be able to make a conclusion based on your approach, based on your study design? So this is where you really want to, maybe as part of your investigator team, have a statistician who can help you develop sample size considerations and This is where in that you want to be clear, succinct, and show that you have considered these points and that this is the sample size, if it can be calculated, and this is what you need. And then you need to say, at my so-and-so institution, we see X number of patients, or we do X, and based on the sample size, we can do this in 3 years, or we can do this in 2 years. You need to be explicit in saying that, because it's, how are you going to do it? Have you thought about what you need, how much you need to do, and can you do it? And so that's, I think, some of the key points when you write your approach section. The environment gets back is really an extension of the investigator team. It's I kind of touched on it when I was talking about investigators, but it's really about the institution. And this is not just about your mentoring team, but this is about what are the institution's resources. Some schools and some hospitals have cores. Some that are provided by the School of Medicine or the Department of Medicine, Department of Pediatrics, and that you can tap into. Maybe biostats cores, various type of assay cores, like an immune profiling core, a mass spectrometry core, things like this that you could identify. Many of the academic institutions that you might be coming from also have Spectrum grants. These are kind of NIH grants to institutions to help support clinical trials and clinical research. And if you have a Spectrum Center, or a CTSA is the other word, CTSA, if your institution has a CTS grant, this is an opportunity for you to include that and then identify how you might use some of those core resources to further your projects and further your success. So basically, talk to your mentors and look into what resources that you can further tap into for your growth. So here are some comments about the reviewer. So, you're putting this whole package together. Part of the point of writing well and selling a story is because think about your audience, and that's the reviewer. And I say, as I would guess, it's because I've been a reviewer for some, but I don't have extensive review experience. I have reviewed some grants, and I've helped others write their grants. And I've received reviews from many grants I've submitted. So these reviewers are often tapped because they've demonstrated that they're accomplished in a certain area. And by definition, they're successful, which means by definition, they're busy, which means you cannot assume that they're going to spend as much time on reading your grant as you spend writing your grant. In fact, it's probably going to be 1/100th, and that's a tragedy, but that's a reality. They have a short attention span. They've been assigned several grants to read, and frankly, reading your grants are not necessarily going to pursue their own career. It might give them some ideas. It might see where things are going, but in a way, you have to remember they're doing this almost on a volunteer basis. So your grant inherently conflicts with many of their other priorities. And things you can't control about your reviewers is that sometimes they'll just have biases that might say, like, they've already thought about your idea and they don't think it can work. So they might go into your idea very skeptical and cynical, and unfortunately there's nothing you can do about that. The only hope is that that's why you have more than one reviewer. You might have, that's why you have 3 reviewers. So there's a little bit of, trying to mitigate some of that randomness. There's aspects of and things you just can't control that requires a bit of luck. You want to hope that your reviewers read your grants when they're really in the right frame of mind, and they're not reading your grant, and that unfortunately your grant's not at the bottom of the pile, and they're reading it just before they're eating lunch, and so their attention span's even shorter. These are things you can't control, so don't bother worrying about. I'm just telling you this so that you don't take the reviewer's comments so personally. You have to understand that this is part of the process, and sometimes you may have written a wonderful grant, but then it may have been poorly received. That doesn't mean the reviewers are the authority on its true authenticity. That just means you have to keep at it. You have to read their comments, but read it with a grain of salt and see and take what you can positively and make it better. But if you disagree with the comment, you disagree with the comment, and you discuss that with your mentors, and sometimes you'll resubmit and keep it that way. And sometimes in a second cycle, you don't have the same reviewer. You have totally different reviewer, which can be very frustrating because the reviewer who read your paper on the first cycle may have rolled off the committee or may have not been available. So they bring in another reviewer who might drive you crazy because what you were responding to one reviewer, their comments will be totally different or may have been how you originally wrote your grant. So that can sound very frustrating and inconsistent, but that is part of the nature of this process. And just so that you know, therefore, you're not going to be so personally invested when you get some of these comments. So I think what you can control is to keep your writing well and simple, tell your story, use some color figures, tables, graphs effectively to try to maximize that short window of time you have with them. And then just hope that you have a little bit of luck with your 3 reviewers. Don't worry about the things you can't control. Enjoy what you can and use it as an opportunity to clarify your ideas. I think personally, for me, what I most enjoyed about writing about the grant process was that it really forced me to be precise and honest with myself about what you can do. Now, there is some grantsmanship in the sense that you often will say, well, gee, we can do it. And then sometimes when you are fortunate not enough to get a grant, then you may realize, oh gosh, we really have to work hard to get that sample size. But anyways, I think the process itself can be very rewarding. I would say more rewarding than even writing a paper, because it really gives you not just an idea of what you're doing, but gives you an opportunity to really delve into some of the resources and build networks in your own institution. And many of my current networks and professional relationships really started out from the proposal of a grant. Persist. You're going to get rejected. That's part of it. And be resilient, maintain a positive attitude. And then, as I was alluding to before, when you get the grant, well, now you have a different problem. You actually have to do it. So I'm going to stop right there and open it up for questions.
Anyone has any questions? We have still some extra time. Dr. Park, thanks a lot. It was a really great review about very important points in grant writing and what really goes into it. So let's see if any of attendees have any questions. No. Okay, so I think I will have one at least. So you already pointed out that you sent your first grant, I think, during the 3rd year of your clinical instructor year, but you mentioned that it is better to start early, Dr. Park. So we have, I think, both residents and also GI fellows, as well as clinical instructors or young faculty in the training and scholars committee. So when do you think, actually, if any of us has a unique idea during our training period, when do you think that we should really start thinking about it and trying to bring the components, or at least try to lay out the process?
So I don't think it's ever too soon to start. I think the reality is, I think you really want to start to the extent you want to pursue an academic career. I think whenever you think about papers that you're writing in your 1st and 2nd years of fellowship, if assuming you have some of the time, you want to think about, after you finish your project with a faculty mentor, is it something you want to kind of delve in deeper with? And if you did, what would you do next? You kind of start doing that when you write the conclusion of your papers, because you kind of talk about limitations and what the next steps would be. And the question is then, are these the steps you really want to take? And what would it take to do that? And could you start constructing, what would a grant look like then? What would you need money to do besides protect your time to do that? So I think you can start doing that, but it's going to be in the third year of your fellowship, the second and third year of fellowship, that you really want to crank up the gears and start putting pen to paper and kind of putting out ideas and floating out some of these ideas with some of your mentors. Because as a junior faculty mentor, junior faculty and someone junior, you're going to need mentorship buy-in. So whatever you want to do, you're going to have to get your mentorship. So part of it is taking these preliminary ideas and having discussions with your mentors about what you'd like to do and what you think you could maybe do over the next 3 or 4 years, and putting that as a grant. You can even do a simple exercise of writing specific aims, 3 to 4 specific aims on a big idea or an idea you want to do, and use that as a framework to have a discussion with your mentors. And as you find traction and refine that, then you have the seeds of a grant.
Awesome. Any other questions? Well, I will have one more question then, Dr. Park. And so you mentioned that you have submitted to many places before you get it from the ACG. So what do you think are the best options for fellows and junior faculty? I think you named few of them already during the process. And how many, is there any specific number, or what are the general approaches, especially for trainees and young faculty during this process? Because I think it takes at least a couple of years until you really have a successful submission. You get a small pilot grant or career development award.
So what you'll always hear are the marquee or the key grant would be the NIH grant. But then if you're in the VA system, the VA has a wonderful grant system that you could potentially apply to. Fortunately, being in the GI space, there's a lot of societies and who are dedicated to providing the ACG, ASGE. I don't know, I'm sure the pediatrics groups may have some funding too, but then there's the topic-based societies like the Cystic Fibrosis and the Crohn's Colitis Foundation, I'm blanking, PanCan for pancreas cancer, and the other pancreas disease groups also have seed funding that they would want to support. So I think those are some opportunities. I think compared to other trainees, we're fortunate in that regard. And so I would say that the other thing is relating to the CT. Many institutions will have their own institution care awards. And also grants and pilot grants that you could get from your own division department, and try to get those if you can, because that also builds into your track record of success.
Awesome. Any other questions?
I have a question.
Okay.
I had one question, Dr. Park. This is Addie. One of the things that has come up for me in terms of grant writing has been getting different perspectives on it from multiple people. Do you have any general guidelines in terms of how many people should be involved and what types of vantage points you look for when you're selecting people to look over your grants before you submit them? So
that's a great question, Addie. I think because on one hand, there's the thought of the wisdom of the crowds, and the more people you have look at it, the better. And then that contrasts to too many chefs in the kitchen, and it becomes not pragmatic and feasible. So there's no set answer. I would say that what would probably matter most are some political considerations. Number one, who is going to be your primary mentor? So that's going to be obviously going to have probably the most influential voice. Then number two are going to be your secondary mentors, and this is going to be kind of really case-based by what skill sets you already have, what skill sets you want to develop, and who could be the methods mentors or the other supplementary mentors. So they are going to probably want to see that as well. So that's going to be maybe an additional 1 or 2. So you're already talking about 2 or 3. You might have some collaborators that wouldn't, that you may want to share that with them. But then at that point, I mean, if you have some mentored relationships who may not be directly involved, but whose opinions you trust, or because they're seasoned and you have some rapport with them, you can ask them to read it, more from a collegial perspective. And they can give you, and that probably wouldn't hurt. You just have to take it with a grain of salt that you're not going to necessarily take all their ideas, but you just want them to kind of get some feedback. But that kind of inner core group that's going to be the group that you have to be most responsive to, because in a way, when you submit this grant, you're not just submitting on behalf of yourself, you're submitting on behalf of the institution and the mentors who are going to be accountable to you. Does that make sense?
Yes.
Awesome. Any other questions? Yeah, I think we are almost there. It's 2 o'clock. Dr. Park, thank you so much again.
Yeah.
On behalf of the...
Yeah, you're welcome. I just want to add one last... Yeah, just to Addie's question, one last point was, I would also practically recommend, if you think it's appropriate, to have your division chief read it. Even though your division chief may not be directly related to your project, it serves 2 purposes. One, they're often senior and they have some experience with this. But number 2, it also, in a way, allows your division chief to kind of know what you're doing. And there's a form of self-promotion, and I would encourage you to do that.
Awesome. Great. Thanks.
Okay.
Again.
Thanks, everybody. Again, I apologize for the delay. Yeah.
It was a great presentation. Thanks a lot, Dr. Park. One more time.
Okay. Thanks, guys.
Thanks.